Lorain County is a great place to live. It's a great place to raise your family. It's a great place for children. We have a very rural population, and we also have a very suburban population. We have some larger cities within Lorain County. We also have a lot of farmland, so we have a lot to offer here for families and children in Lorain County. Prior to the waiver, we were very limited. There were situations where we were actually forced to remove children in order to get them treatment and place them into foster homes.
Traditional Title IV is restricted to funding out-of-home care. And certainly 20 years ago, Ohio had a very large number of kids in out-of-home care. In fact, in the late 90s, we had risen to about over 20,000 kids in Ohio were in out-of-home care placement. And we certainly knew that that number needed to be reduced.
State funding, everybody got the same amount, and average it was 10 cents on the dollar. And you could only get federal funding if you paid for placement and got a reimbursement for that placement. So the available federal funding that's more flexible is like 5 cents on the dollar. And that's just not enough to really invest in families. We were investing in foster care.
In the 90s, the federal government knew that Title IV-E needed to look different. They were the ones, the federal government had the wisdom to say, hey, let's let some states try something different.
When the opportunity came to seek a Title IV-E waiver and allow those funds that had only been available for placement to be used flexibly, there was a lot of discussion.
When Ohio applied to become a demonstration project, and originally actually 14 counties came together, they named their demonstration project Protect Ohio, and it has been called that ever since.
When you look at Protect Ohio and what it's done for all 14 counties, we have all benefited tremendously. And those organizations that have tend to have been the most creative, dynamic, professional, and aggressive in the delivery of services have tended to flourish the most. And I would certainly say Lorain County has been a tremendous leader for all 14 counties. And of course, there are 18 counties now. Their numbers, their outcomes are tremendous.
We established an ISP board, an Integrated Services Partnership Board. We actually were able to get the executive directors from various agencies, service providers in our county, such as mental health, drug and alcohol, children with disabilities, the court, children's services, and we basically, to this day, meet once a month. We were able to pool funding together from all of those sources. And when you have some flexibility in using your funding, you are able to pool those resources, you're able to collaborate with other individuals, and quite honestly, through that board, we no longer have to worry about financing in our discussion. We can really start having discussions about needs. What does this child need? Without taking 2/3 of that discussion being how are we going to finance that. So we really can concentrate on the needs of the child because we're able collectively to pool that funding to meet the financial obligations associated with those needs.
We were also able to do a lot with our foster care and adoption department too, in terms of combining those departments so that we had a very strong foster to adopt program and a way of having kids who have to come into foster care and they stay in foster care, they can't go back home, then they're most likely with their permanent forever family.
We had fertility issues, multiple miscarriages, and once we had a couple, I think we just decided to start talking about adoption as one of our options, and it came to that. So We knew right away that we wanted to foster, though, to adopt. We didn't want to go through a private agency. They were our very first placement. They called and said they had a 5-month-old baby girl, and we were very excited, thinking, yay, finally a baby. And they said, and her twin sister.
I think foster care and adoption has been so exciting and so positive because we see the impact on the child. The families come to us with these great sets of skills and commitments and love and wanting to do the right thing, and then they get a child in their home, and that child blossoms.
We actually have had family come to us and question us about our experience because they were looking into adoption overseas, and then they were looking into another county, and we told them no way. They had to go to Lorain County. It was the best experience ever.
We have to be able to assess the families and strengthen the families and support whoever that long-term family is. The waiver allows us to put together the services that are right for that child and that child's family.
Because you don't always get the best services when you are trying to fit children into funding. When you are fitting funding to the needs of a child, then you get much better outcomes and much better services.
We used to go out because Tommy had a black eye. And when we went out, we talked about Tommy and how did you get this black eye, and Mom, how is this not going to happen again? And then we realized, but there might be more going on than Tommy having a black eye. And so the whole system changed. We started doing family assessments and trying to gather what does this family need so that we don't have future maltreatment, so that the black eye doesn't happen again, but so that they don't become homeless or substance abuse doesn't become a problem. So I think social work has shifted. We aren't incident driven, we're really looking at families and families' needs.
So just imagine that flexibility. Just imagine coming to work every day and saying, oh my goodness, this child needs this or this family needs this, to prevent them from coming into foster care. If I can keep children in their own home and in their community with services and flexible ability to provide whatever they need, I have a win-win situation.
Pre-Protect Ohio, we were very much restricted in our ability to provide those magical services to children and families in a proactive, preventive fashion. What I love about Protect Ohio is the fact that we can provide any service to any child in any setting and create those magical moments without any hesitation in a proactive, preventive form, and that's what makes Protect Ohio absolutely outstanding. This has got to go nationwide. It's got to, because it's just the best way to do it. It's just the best way to do child welfare. And this gives us our best shot in a preventive fashion, in a proactive fashion, in a professional fashion to ensure the best possible services are delivered. And we've got to get it to the point where, as a nation, this is what we do. This is how we're going to accomplish that.